Welcome back, everyone. I'm Dr. Darrell Wolfe, and this is called DocStar TV. Now, today I'm going to be having a guest on. His name is Neil. We won't be telling you anymore, but we will be going through his case history. Neil has had a problem, okay, that always starts off as a small problem, just starts off as a symptom. I need everyone to get this. There are no diseases. There are no diseases. I need you to get this. There are only symptoms. And the symptoms that you have in your body are called body talk because your body just loves you. Your body's going to talk to you. And did you ever notice something? You'll have pain for a while somewhere, and if you don't take massive personal action and help to get rid of the scar tissue issue, the calcification, the crystallization, the inflammation, and the infection that's starting it on an emotional and physical level, your body will stop showing you that symptom, and it will become something more chronic, and then the medical system will call it a disease. And then guess what? You'll go from just taking painkillers to antidepressants to taking other drugs. Because guess what? The same symptom that you started off with that was just something niggling you is now called a disease, and it's an autoimmune disease where it's attacking you and you can't focus on anything. It's basically eaten up your personality. It's taken over your reality. It's taken away your energy. Okay, as far as your personality sucks. Okay, your personality sucks because it's sucking the energy out of you. Tell me that when you don't feel tired or when you feel pain, okay, that you're not kind of miserable. You're working on trying to be a nice person. How does somebody who lives with pain and inflammation and stiffness, okay, or they even start saying this, it sucks to grow old. Well, you know, I'll be 67 years old and it doesn't suck to grow old. When you know this, that you need to not bend the rules, break the rules, you need to make your own rules. Yeah, okay, you're either going to get it or not get it. And I said this the other day because people will come on here because they're not used to some kind of practitioner like me. They're used to a practitioner that's going to stroke you, or is going to poke you, cut you, burn you, or give you toxic things. That's it. Or stroke you and just try to reduce your pain, your inflammation, but never ever reverse it, because as long as you go to treatments, you will be mistreated. When you decide that I'm going to go get treated and trained and I'm going to leave there because I don't need Dr. Wolfe anymore. I don't need his practitioners anymore. I can do this for myself. This is my God-given body, and I'm going to understand that from the moment I rise until I close my eyes, I will be the surprise that saves me, the surprise that heals me, the surprise that feels me. Because understand something, don't think your way through life, feel your way through life. How do you feel right now? How do you feel about that body of yours? Has it become a frenemy, like half-assed enemy, friend, or is it your friend? And it's not your friend until the end if you don't know how to look after it with every breathing breath, if you don't know how to stay in the conscious moment, if you don't know how to own it. Okay, first of all, when somebody says they have a great bowel movement, I definitely know they don't. Because how many people have you pooped with? Have you ever gone to my library and watched How to Become Number One at the Art of Number Two? When you're going to tell me that you're in great shape for somebody your age, you're just a statistic. And understand, they change the statistics every few years to suit the majority. And the majority has an autoimmune disease. The majority is obese. I hope you know that. You do know that 40 years ago, being 10 pounds overweight was obese. Isn't that something? Why don't you just go back and take a look at the beaches in 1970 and go back and take a look at in 2023, okay? And you'll see that it looks like it was a bunch of beach whales. Now you're going to go, oh, you're nasty, Dr. Wolfe. No, I am not. People are not overweight. They're overweight. They're overinflamed. They're overinfected. So their body has to make fat cells. And then they have to make so much fat cells that guess what? The majority of the population is now not overweight, but obese. If you were to go back 40 years ago, obesity was 10 pounds overweight. Now it's 40 pounds overweight. So I call BS, dysfunctional belief system, and I call that What is normal today was abnormal even a quarter of a century ago. I call that it's abnormal to have a cane. I call that it's abnormal to have a walker. I say it's abnormal to be in a wheelchair unless you had your spine cut, okay? I call that abnormal, and I say that that can be reversed. But here's the deal. It's not going to be reversed because guess what? Because you already gave up. You gave up on an emotional level. I would have given up too. You know what? Let me tell you something. Guess what? You're going to tell me that medical system is health? It's not health. It's there for emergency care. Thank God we have it. So you need to understand this. I am not putting it down. Emergency care is essential. If I get into a car accident or I get into a sports injury, I know that I want it there. I want it there. I want it there, and I want it there because it could save a life. But if you're going to use emergency care for your daily care, then you're going to become a 911 emergency, and that's the truth. So people will do this every day. Even my master trainers will come on and they'll start giving me some medical jargon that is full of BS. It's a dysfunctional belief system because there are only symptoms. There are no diseases, and all symptoms are your body trying to get well, not put you into hell. You're in hell because you don't know how to love, honor, and respect that beautiful body of yours. And you know what? I'm going to make it my goal, my mission, to make sure that you all have the best chance at having the most beautiful life that was promised to you. That you learn how to master your mind first and foremost, because if you don't, you'll never master your body. And whether you want to believe this or not, only 1% of 1% of the population will ever get the life that they deserve down here. You actually believe, okay, that the majority is as good as it gets. And we do that on a subconscious level. Understand something. I am not a statistic. I never will be. I'll be 67 years old. I'm in amazing shape. And you could be in amazing shape too. I don't care if you have a cane or a walker or a wheelchair. I don't care if your family's trying to push you off into the nursing home. We can stop that. You need to understand you were set up and you were sold off by the pound. And I am a different type of practitioner, so don't be upset with me. Just leave my platform if I annoy you, because I don't want to annoy you, because I don't want to make you sick. So understand this. Do you know how to love, honor, and respect yourself? Do you know how to take care of yourself? This is what we're going to be talking about on these lives. I decided to come on these lives, and so anyways, can I just say this, everyone? I don't mind doing it. I like playing this game. So DANRUCCI 1966 says, who's listening to this SHIT? Well, believe it or not, 1% of 1% will listen to this SHIT. Okay, is that okay with you? And they will listen to it because they're tired of suffering and they're tired of being promised something better. And those people who do not want to have a limp, a cane, a walker, a wheelchair, who do not want to be medicated and believe that they have unlimited possibility and that they can reverse the irreversible, my friend, are going to be listening to this stuff. So understand this. Go ahead and say whatever you want to say. If you want to banter at me, I'm just going to repeat what you put on here. And then I'm going to say who you are, not to out you out. It's because I'm not scared of you attacking me on my platform. I expect people to attack me on my platform because I'm not normal. I'm abnormal. I demand for much more in my life, and I will deliver much more to people than they think that they could ever get. And that's what's going to happen. So all of you people that want to come on here and banter, go ahead. I will read it and take a break and read it to everyone to let people know this, that guess what? I expect it. You know what? I mean, how many people think, drink, and eat and live like I do? They don't. But I am more normal because I am more healthier than almost any other 67-year-old I know. So the reality is this, and also understand this, everyone. If you don't know me, I know that I'm probably the only clinic that gets a money-back guarantee on a perfect day consultation. which we give you 6 weeks of unlimited support. And then you can call in for the rest of your life, no matter how much you want, with our master trainers for free. Now, tell me who does that? You know, you don't put yourself on the line. So who listens to this? SHIT? I don't know. We'll find out. And guess what? When people come to me and they say, look, nobody else has been able to get rid of my cane, my walker, my wheelchair. I'm booked for surgery. We have a money back guarantee that you're not going to go to surgery. And that's only after the first treatment. We will actually have you stop hoping that you're going to get well and have courage and faith after one treatment. Now you can say, wow, that's some marketing ploy, Dr. Wolfe. It's not a ploy. I've been doing it now for, ready for this, 35 years. I've also been teaching my technique for 35 years. So who's listening to this SHIT? Only those people that believe that thinking outside the box and what we call normal today is actually us being set up that by a small group of people. That's who's listening. Now, I'm going to go through some things because I hope this won't take long, and then I'm going to bring on Neil. Neil is frustrated like everybody else. You know, your subconscious rules, schools, and fools you, whether you want to believe it or not. Your subconscious is 90% of your brain, and whether you believe it or not, 70 to 90% of those beliefs have nothing to do with creating a beautiful life. It's undermining your life. So if you have trouble with your life and there's too many bumps in the road, just understand something, that you're going to have to become conscious to how you think, how you drink, how you eat. But most of all, you're going to have to what? Start learning about how you feel at every given moment. Are you connected to your breath? Do you have a slight smile? Are you reactionary? Or do you have powerful belief systems that will keep you from destroying yourself and everyone else around you? Here's what's going down. So I'm doing what's called a world tour. I'm going to be in Stuart, Florida, and I'll be there in 2 weeks. And then I'm going to McKinney, Texas. And then I'm going to Barrie, Ontario. Then I'm going to Chicago, Illinois. Then Calgary, Alberta. Then Glastonbury, UK. Then Coffs Harbour, Australia. And then I'm going to Poreč, Croatia. And then from there, I'm going to Bangkok, Thailand. And we're going to be doing 4 complete trainings. Now, in all of these countries and cities I'm going to, we're doing an average of 3 to 4 free lectures. So all of you that would like to come out and challenge yourself or challenge me, I welcome it. But come out with an open mind. Come out and just be ready, because guess what? If you want different in your life, then you've got to have different. So if you're not going to accept different, then how are you ever going to have different in your life? I want you just to think about that. Okay? I think we've been set up a little bit. So come out to my free life-changing, life-saving lectures. We are going to be doing trainings and certifications. We're going to be doing what's called a whole life coach certification, which is a 12-day certification. And that's to become actually certified by the world's leading body that actually can certify you all the way up to getting your doctorate in natural medicine and your doctorate in indigenous medicine, and that's through us. So who listens to my stuff? I think a lot of people are going to be listening pretty soon. So the other thing we do is it's called Braveheart Health and Healing Circle, where people can actually come in and we actually get into a circle. Now, this is more for the general public. If you want to find your authentic self, if you want to stop suffering, if you want to claim your life from the moment you rise until you close your eyes, if you want to stop reacting to everything that everybody else does, until you reclaim your subconscious and you create your own unconditional self-love, self-care beliefs in that mind of yours, your life will be a landmine. So understand, this is for people that want to have the most intense training, and it's called Whole Life Coach Certification, and it is 9 days. And those people want to come for the Braveheart Circle. You will discover your real self, and you will fall in love with yourself again, as if you were when you were a child. And that's a 7-day course. Now you can go to braveheartnation.com and take a look at these things, and then you can even call me and challenge me at 469-861-9454. Okay. And that's on WhatsApp or just direct. It's a USA phone number. Or you can call 855-900-4544, extension 5. Or you even call me around the world on my Skype at that's DOC dot OF dot detox, doc of detox. That's on Skype. Now, what else are we going to be doing? Well, those are 3 courses. And we're also going to be doing Wolfe Non-Surgical, which is a 12-day course. And I promise any chiropractor, any massage therapist, any therapist, and any other body work that this will blow your mind. How would you like to be able to offer a money-back guarantee, which I haven't seen any chiropractor, massage therapist do, or acupuncturist? And understand, I'm 2 of those. Okay? I've got 2 of those degrees. And understand, they don't do it, but you will leave and you will offer a money-back guarantee to all of your patients and clients on the first treatment that you'll go further with Wolfe Non-Surgical in reversing their problem, because there are no body workers that really go in and pull the scar tissue apart or get the calcium back into the bones or melt the crystallization. And we're going to be talking to Neil in just a minute. The last course that we do is called Pain-Free Pelvic Restoration. Yeah. And this is a 3-day course for women. If you want the most healthy and healed pelvis, and what happens in a woman's pelvis? Oh, I don't know, bladder infections. The uterus is actually falling down and out. Endometriosis. Okay, how about fibroids? How about infertility? Okay, how about tumors? Okay, how about just basic inflammation and infection? How about painful lovemaking? All of this will be reversed. What about gout? Well, gout is a crystallization. Okay, and what I'm going to do tomorrow is I'll just come on and I'll chat like this first. And then I want people to take turns coming on and give me your questions. And tomorrow I'll come on around this time, and I'll stay on until I've answered almost everybody's questions, or until I'm so thirsty I need to drink. How's that? And I promise you that. I'm going to be doing this all the time now. I'm going to reach out to everyone around the world, because we're going on this world tour, and we're going to actually give unconditional love and teach people about self-care and self-love. And that, guess what? You don't need a practitioner. You need to become your practitioner. You don't need to be treated. You need to be trained. At the beginning, sure, we'll treat you, but you better get trained on how to look after that beautiful body of yours, because guess why? That's because it never works. Everybody goes from treatment to treatment, don't they? Treatment to treatment, yes or no? Okay, I'm only good to my next treatment. How about ending that? How about getting the life that was always promised to you? Well, guess what? There's only one person responsible for that. There's only one hero in this story. So the other thing is, you can go to braveheartnation.com and you can book us. You can book us for personal treatments. We'll actually come and do personal treatment and trainings with you. We'll teach you and your wife how to do non-surgical on each other. We'll teach a group how to do that. That's the most powerful body work. We'll teach a caretaker how to do that. We'll teach an association. We'll actually go to clinics around the world, and we'll certify health professionals in their own clinic. We'll come to you. Okay. So we have like 5 different personal treatment and trainings, and then we have certifications for professionals as well, or people who want to be professionals. The world is changing, and you better change with it. You know, there is so much blue light poisoning now. Okay, blue light poisoning is everywhere, and blue light poisoning. I don't have my Teslas right here. I should grab them, but guess what? I need to tell everybody this. If you're on your phone or on a computer, there's only one pair of eyeglasses that will actually work, and you can buy Teslas now. They're called Tesla eyewear, and where you can buy glasses, put your own lenses in, and then have the fullerene lens that comes down. If you don't protect yourself against blue light poisoning, you know, 10,000 teenagers are actually diagnosed every day with cataracts. And I'll be bringing Diana on to talk about how to get rid of cataracts, how to get rid of tinnitus, how to get rid of sinus problems. And we'll be teaching you about basic things. And I'll go through anything you want. Like tomorrow, I'll answer all your questions. But like I said, go to braveheartnation.com. And if you want, I'll be in Stuart, Florida, like I said, in 2 weeks. I'll be in McKinney, Texas, then Barrie, Ontario, Chicago, Illinois, Calgary, Alberta, Glastonbury, UK, Coffs Harbour, Australia, and then Poric, Croatia. And then I will be in Bangkok, okay, Thailand, and that will be where we'll be ending our world tour. And I will be opening up what I believe will be a 5-star clinic where we will not be taking on people for treatments anymore. We'll only be taking on people that want to come for treatment and leave there already trained, whether they're a couple or a family. I believe that if I've got enough practitioners, I've got about 600 practitioners around the world that do our training that we've trained. So the reality is we want to create clinics that people don't come for just treatment, they come for training, because if families and couples and people do not learn how to look after themselves, well, then guess what? If I don't own you, someone else is going to own you, and they're going to sell you off by the pound. I think that's already happening. All right, so let's get right started here, okay? Okay, so Neil, would you like to come on?
Yes, sir.
Hi, Neil, how you doing?
Well, I'm just hoping that we can get something going here.
Okay, Neil, I'm going to need you to turn your phone up a little louder and speak a little louder into your phone, please.
Yes, sir. Can everybody hear me now?
No, a little louder, my friend.
Okay, I unplugged it. Maybe that'll help. Can you hear me now?
We can hear you, but speaking loud, I don't know what it is, but go ahead.
Okay, I'm going to speak really loud. Okay, that's good?
That's good. Now, Neil,
yes.
So let's just in a nutshell. So you said that you've got a leg problem, right? And it's been going on for how long? You have a leg problem. How long has it been going on for?
Well, okay. It started with an initial injury of tearing the ligaments in
my ankle.
I know,
that's fine. We're going to get into that, but I just want to prove a point. How long have you had this leg problem?
Well, okay, it started at 19 years old, but then I got a podiatrist that makes special shoes and insoles.
I understand that, Neil.
They wanted to give me surgery for a torn ligament, and I didn't take the surgery. I just want you to know that.
Okay, but Neil, I just want to know, how old are you now? How old are you now, my friend?
I'm 67.
And the problem started when you were what?
The problem started when I was 19, but it got better, but I did not take the surgery. I didn't take they were going to sew up the ligament in my ankle. I didn't do that. They said the muscle will grow around it, but it'll never be that strong. So I curtailed my aggressive behavior on skateboarding and motorcycles and all that. I curtailed it, and I was okay till I was around 50. And when I was 50, I was okay, but then I was running with my dog.
Okay, can you hold on for a second, Neil? What we're going to do is I'll let you speak, then I'll speak. We'll kind of bounce it back and forth like a pinball, okay?
Okay.
Okay, so the reality is this. Maybe he would have been better off at doing the surgery when he was 19, but the reality is guess what? Has anybody noticed anything? When you get the surgery, you may not have the pain anymore, but you don't have the flexibility. You don't have the flexion or the extension. You don't have the strength. Because after every surgery, you're going to have more scar tissue than you had before the surgery. So understand, I'm not here to tell you not to get surgery, but I will tell you that your body overcompensates in making fibrin and taking calcium from the bones closest to where the accident is. And then what happens is you have that stiffness. Did you ever see Grandpa and he's walking stiff as a board, and you say, "Hey, Grandpa, are you okay? You look like you're walking as stiff as a board." And Grandpa goes, "I don't feel a thing." Well, he doesn't feel a thing because all the calcium that's been pulled out of his bones and all the scar tissue is wrapped around the nerves. Now, if I can say something, people will say, "I've got stenosis," right? Okay, so do you know what that is? Stenosis is actually so much scar tissue and crystallization, okay, in your spine, and the doctor will tell you, and you know what I'll do tomorrow? I'll come on and I'll do this tomorrow. I'll play it for you. This is the top surgeon in New York talking about stenosis, saying that the nerves are dead. And this same patient, okay, in one treatment, we were able to prove the nerves weren't dead with using Wolfe non-surgical. The nerves don't die. They just get calcified and they get tons of scar tissue wrapped around them. And that's why you're as stiff as a board. That's why you don't feel like playing sports anymore, because you feel like you're going to tear out, because fibrin is not like an elastic that it snaps back. It doesn't have a lot of circulation. Have you ever eaten a piece of beef jerky? Well, go eat a piece of beef jerky, and that's what happens every time that you have surgery, you're left with beef jerky. And those of you that have an inflammatory diet and you're pooping in your pelvis, well, you're going to have beef jerky everywhere and you're going to feel like you're aging. And that's when people say it sucks to grow old, because you're stiff, you've got inflammation, and all due to infection. Here, 1 second, Neil. Dr. Wolfe, my husband had 2 surgeries because he had 7 hernias. Understand something. He probably had inguinal hernias, which means he now, believe this or not, your husband was pooping in his pelvis so much that he actually rotted out the peritoneal lining that was holding his intestines into his abdomen. And then his intestines are popping out, and that's what you're looking at. That's a person that's rotten to the core. Now, if you take a look at anyone, you can reverse this without surgery. I've had people that it's as big as a large plum sticking out. But the reality is you'd have to do things like the perfect day diet, advanced water fasting. You'd have to take massive personal action. If you're not willing to take massive personal action in your life and be the practitioner for yourself, then sometimes surgery and drugs is the only option. So for people who do not think that there's a way out, thank God there is surgery and drugs to numb them out, because they wouldn't be able to handle the pain. They'd become suicidal. Now, Neil, I won't be able to answer a lot of questions here. I want to let Neil go first. So after we're done with Neil, if we still have time, please come on with your questions then, okay, everyone? And if not, join me tomorrow, and I promise you I will answer them, okay? Neil, go ahead, and let's talk about this. You talk, I'll listen. But Neil, if you will, let me break in when I have something that I want to say so that we don't back up too much information that I want to put to everyone, okay?
Sure.
Thank you, sir.
Okay, so
you have to speak louder, Neil. I don't know why, but
my dog when I'm around 50 years old, about 17 years ago, roughly, and my ankle went out on me, so after that,
So wait a minute. You walked your dog.
Yes.
You walked your dog, and your ankle went out on you when?
I was running with the dog, and I tried to run real fast with the dog to see how fast he could run to try to keep up with him, and my ankle just went out on me.
Okay, can I say something now? So I'll keep doing this, and guys, it's not to break in or to run over Neil. Neil, you've got to say things and then leave a pause, and then I'll do the same thing for you, okay? His ankle didn't come out of place, anyone. What he did was he micro-teared the scar tissue that was always there. If I were to go in and work on Neil's ankle, because understand, I want to show people something right now. So let's say that this is a normal tendon, ligament, or muscle. Guys, it's all tissue. Or meniscus. So anyways, in between every fiber, you've got circulation of blood and lymph, believe it or not. Now that's feeding oxygen. Now all of these fibers are going to stay flexible. When we become inflamed, does everybody understand the word inflame? Well, inflame means that that's a flame. So it's like taking the steak, putting it on the barbecue and letting it sit there. What happens? Well, things shrink up and they dehydrate. Yes or no? So inflammation causes dehydration of the tendons, ligaments, muscles, meniscus, whatever you want to talk about, or organs. Same thing, everyone. Inflammation can do it to organs. So what do you think cirrhosis of the liver is? That is actually scar tissue. What do you think fatty liver is? That's inflammation of the liver. Okay, I hope you're getting this. And due to inflammation, we create fat cells. And if we go further in that, we create cellulite. Further in that, we create scar tissue. Further in that, then we create fibroids. Further in that, we create tumors. Are you with me yet? So now we keep losing oxygenation, nutrition, and we cannot detoxify the cells properly. And remember something, there is no damage in the body unless the cells become damaged. And what part of the cells become damaged? The mitochondria that create the ATP, to create the energy to heal. So those mitochondria, when the cell becomes acidic, there's inflammation. And when it gets inflamed, it brings in calcium, believe it or not. That calcium actually causes a bond around the mitochondria and then doesn't allow it to spin 2,500 times per second to create the ATP to heal the cell. Now, whether you believe it or not, all so-called disease, right to cancer, is a mitochondrial problem. Now, so what happened is if I would have been able to get in and work on Neil's ankle, I would go in, and we're starting off with this, right? I feel I got a knot in my neck, okay? I feel like my shoulder's frozen. Well, it's frozen because all the fibers are frozen together like crazy glue. So if something is not open and flexible, okay, and it's frozen together, eventually it's going to come down and feel like a knot, like a fist. And you know, you could call that a knot in your neck, or I feel like my back's going to go out. I've got a knot in my back. You could call this a scar tissue issue anywhere in your body, right up to a tumor. Okay, now, so if I could go in there, the first thing I would do is look for little cracks or a place to get in to untie the knot and open up, okay? And then I would get in between the fibers and reopen them. And guess what happens? If I can go in and untie the knot, open up the fibers, return the normal circulation, guess what? Instantaneously, it goes from scar tissue to actually beautiful connective elastic tissue again, as if you're young. And that's the deal. So understand something. So from beef jerky, we're going to go right back, because when we work on you, we're not getting rid of scar tissue. We're restoring the life into the tissues. And if you do that, then the tissues will restore to the way you were when you were younger before the injury. Neil, do you understand that?
Yes, I heard exactly what you said. Mm-hmm.
Now, understand this. We can get all of the calcium, Neil, that was taken out of your ankle bone, okay, or out of your knee, okay, that is actually now in the tissues, to not just make it like beef jerky because of the inflammation that actually dehydrated it, but the calcium comes in there to stop the mutation. Remember something, if there's too much inflammation, you can go to mutation. If you go to mutation, you go to cancer. And cancer is where you're deprived of 35% or more of oxygen for more than what? 3 days. And that was proven by Dr. Otto Warburg, who was the only person that received the Nobel Prize for discovering what cancer truly is, which is actually stage 4 inflammation, the highest degree of inflammation.
Oh, okay.
So the calcium has to leave the bones to buffer down the acidity, because if we don't, the cells mutate. So let's get that. And understand something, when it comes to your blood, Neil, every time that you get stressed out, every time you're in pain for too long, guess what?
Yes.
The pH changes in your blood, and it can't. If it changes just a little bit, you could go into a coma, or you could even die if it went further. So your body has to pull calcium from the walls of the arteries or from the joints closest to the area to keep on buffering down your blood and your tissues. Are you with me?
Yes, sir.
Okay, so now let's carry on your story. Thank you.
Yes, sir. Okay, so.
Oh, just call me Darrell. Just call me Darrell. We are equals. Everybody needs to get that. I work for you. I work for you, Neil. Neil?
Ultimate respect.
I work for you. No. It's okay. I can get it. But if you call me Darrell, then we're on equal playing ground, and that makes it much quicker. Okay?
Okay, no problem, Darrell. So, all right, so let me get to this, the metamorphosis of the situation here. Okay, so it seemed like it was getting better. I let it like kind of heal up, and what happened is I kept re-injuring it on freak accidents and different things.
Do you understand? Okay, but hold on. We got to make this really understood to you so we can move on. Do you understand that you did micro tearing? It was replaced with fibrin. Fibrin is scar tissue. And because you did not go in and remove the scar tissue by getting the circulation back to where it needs to be, you tore it and you retore it, which was called, you did not get treated properly. So understand, I have a doctorate in acupuncture, and that's not going to treat it properly. So just know that. When I was younger, really young, I became a registered massage therapist. And guess what? I was only 6 months after getting out of massage therapy school, I said enough of this. And guess what I did? I put Wolfe non-surgical together, because it was totally ridiculous, because all I was doing is doing an hour massage on a person's whole body. They felt good for a few hours, but then guess what? I never really therapeutically did anything. Unless you're pulling the fibers apart or increasing the circulation, what are you actually doing? So I want you to understand that you kept re-injuring it because you didn't get rid of scar tissue. Neil, if I take a rope and I tie a knot in it, is it longer or shorter?
Short.
So if I have a tendon, a ligament, or a muscle, and it dehydrates, do you think it's going to get longer or shorter?
Shorter.
So if you try to make the same, let's say, flexion or extension of that leg, that arm, that joint, you're going to tear it out. And guess where the problem lies? Not in the muscle. You have to go to the joints, okay? So we get issues in our tissues, but we get junk in our joints. I can prove to you, if we could ever get together, Neil, we'll go on live. I will work on your ankle and I would work on your knee, okay? And guess what? I would prove that in, how about this, Neil? In 20 to 30 minutes, I will give you back 80% of the circulation and flexion and extension in 30 minutes. Wow. Now understand, I could be in there all day with my fingers, or I could use an acupuncture needle, or I could try to push the joint back into place, but it's just going to pop out because you already told me that if you dehydrate, if you calcify, the tendon, the ligament, the muscle becomes shorter. And until I restore the circulation, then we're not going to have the mobility, the flexibility, the strength. We're not going to have anything. You know what, Neil? Somebody who's got poor circulation, do they have poor health?
Most likely.
Most likely, really. So if somebody has great circulation, do they have great health?
Most likely, yes.
What? No, not most likely. It's yes. It's not a most likely.
Yeah, okay. Okay.
All right. So the reality is, if somebody has poor circulation in a tendon or a ligament or a muscle, all we have to do is restore the circulation back to the way it was, and we restore the actual vitality. And I don't care what age you are, 9 years old, 90 years old, I'll prove the same thing. And understand something, everyone. I just went through and told you all of the cities, all of the countries I'm going to be in the next 10 months. So when I'm doing these lectures, you come in and you say, Dr. Wolfe, I want you to prove to me that you can do this. And well, okay, there's a mat right there. There's a chair right there. Let's do it right now in front of everyone. So understand this. It's one thing to say something, and then it's one thing to do it. And we will do it, and we will prove it, that everybody has been sucker punched when it comes to therapy. It's great to push the joint back into place, but do you think it's going to stay in place if there's a scar tissue calcium issue in there? It's going to pop out of place. That's why people go and get adjusted all the time. Why do you think people need acupuncture? Why do you think people need to get massaged? Why do you think people are taking painkillers? Well, guess what? Get rid of the knot, get rid of the calcium and put it back into the bones, get rid and melt the crystallization. And there goes the pain, because people have pain because the crystals and the displaced calcium are like coral, and they are poking the nerves when you go to move. You get rid of the calcium, put it back in the bones, get rid of the crystallization. And guess what? You're not jabbing your nerves all the time, so you're not going to have nerve pain. Understand this. I'm still waiting. So let's, if somebody needs to come on and challenge me, whatever health profession you're in, let's have a really friendly discussion, because I'm willing to learn if I'm incorrect. Go ahead, Neil.
Yes. So let me go on with the severity of the.
Oh, wait a second. People are asking a question. Go to braveheartnation.com, everyone, and you'll see my whole schedule for the next 10 months. Okay. And I just want to say this, everyone. If you want to get a personal treatment and training for your family, your group, your wife, yourself, or anybody else, we'll come to you anywhere in the world, and we'll send a master trainer, and we'll back everything we say. Okay. So whether it's for a pain-free pelvic course, or you want a couples training, or you want to be certified in anything we do, you just have to go to braveheartnation.com. Go ahead, Neil.
Yes, sir. So the condition kept getting worse, and then so I had to go on a cane. So I used the cane for approximately 10 years.
Okay, can we stop right there? So understand, now you need the cane because you can't put the weight on that joint, because it causes pain, because it's weak. Take away the blood supply, bring in crystallization, calcium pulled from the bones, and make it into scar tissue and shorten the tendons, the ligaments, and the muscles. And guess what? You can't extend your leg. So now guess what?
Right.
You've got a cane. So here's the deal. It's only going to get worse. And remember something, we could have got it earlier. Keep going.
So I was on a cane for like at least 10 years, maybe 12. And then it started to get worse to where I couldn't even use the cane anymore. Can I explain what happened? Or do you have time for me to explain?
No. Neil, you go right ahead, and then you tell a part of your, Neil, you tell a part of your story, and then I'll come in and tell a part of my story, and it'll be an amazing story. Thank you, my friend.
Okay. Well, all right. Well, what happened was I was over, I was using the cane so much, and I'd go shopping at like 3 different stores. I'd run around the store. I'd actually run with the cane. Like I'd hit the ground with the cane, and then, I'd actually move really quick. But what I did is I overdid it, but I didn't feel bad the night I came home from the store. The next morning when I woke up, it felt like a piece of duct tape was on the back of my heel. I actually felt the back of my heel.
Okay.
A piece of duct.
Now we need to take a little break, and here it is. The duct tape was crystallization, everyone. And the reality is Neil, please just try to take this in, and then me and you will talk about this later. Neil,
okay,
you're running a little bit of a self-abusive program, because nobody who loves and cares for themselves will run around like crazy and bang the cane and bang their foot into the ground. So this can be anger for the condition and you fighting back, okay? Or you just don't like Neil, okay? All right? So we'll talk about this later, but understand something. The duct tape on the back was you pounding so much and running around trying to get it all done and saying, I'm fighting back, I'm Neil the Amazing, that you actually created inflammation. And when you do that, you cause crystallization of lactic and uric acid crystals. And that's the same thing that you'll get when you get gout, but gout is different because gout is caused because of alcohol, sugar, flour, okay? It's caused because of too much of those refined things that people take in. And that goes in your toe. And why does it go in your toe? Because it's heavy and it goes down to the bottom, and that's what gout is. But you had gout in your heel, but it was created by you pounding the ground and fighting back and saying, I am not a cripple. Take this. I don't like this crippledness. And guess what you did? You made it worse. But go ahead.
Yes, sir. So, okay. So after that, I couldn't use the cane anymore because it felt so terrible. So I started using crutches for like over a year. And then after about a year on crutches, my leg got so bad that just being on crutches hurt, and I'm in a wheelchair.
Okay, one second, Neil. Just know this: that day that you pounded the ground, okay, you actually had enough, and believe it or not, subconsciously, you couldn't take the cane, you couldn't take the limp. You actually made a subconscious decision to put yourself onto, guess what? The crutches. Now understand, when you're when you were using the cane, you were asking the other hip to do all the work. So understand, the other hip's in trouble now too.
Yeah, sort of, because what happened is both of my, so what happened after I was on crutches, and then after I became in a wheelchair, then my leg it won't straighten out anymore. It's in a bent position.
Okay, well, we got to stop because that's amazing. And I got to tell you something, Neil, guess what? Everybody's blessed by you today. They're blessed by you more than me. Let me tell you that. What did I tell everyone? I said that inflammation causes dehydration and it causes fibrin to build up, which feel like knots. I said, if we tie a rope, when we tie a knot in a rope, is it longer or shorter? Okay, guess what? It's shorter. And what did Neil say? What did you just say? He could not straighten his leg and now it's bent forever. Neil has about 5 knots in the rope, otherwise 5 knots along the muscles, in the tendons, and in the ligaments, 5 to 6 knots. If I tie 6 knots, my leg stays bent forever. So if we don't go in and go into where we got to go into Neil's hip, take that apart. We got to do the SI joint first, go into the hip. Then we got to go into the knee. The knee would only take a half an hour for us to do the first treatment. The ankle would take a half an hour. The hip would take an hour. But guess what? We wouldn't do that all at once. So the first thing I would do is go in and do a half an hour on his knee and half hour on your ankle. And guess what you would say to me, Neil? And I hope we can do this someday. You're going to say it's a bloody miracle. So the reality is it's not a miracle. We can teach everybody on all four platforms that are on here today. I don't care who you are. You are a genius. You have brilliance, and everybody that does the techniques that we do, and I have taught over 1,200 practitioners. Okay, let me tell you something. You can do it just as good as them. The day that you believe that you cannot get yourself well, you have just entered hell. When you believe that you have to wait for a miracle, a medical breakthrough, or you got to go to a practitioner weekly, monthly, whatever you decide you want to do, that's just a belief system and it's totally dysfunctional. Go ahead, Neil.
Yes, sir. So I bless you so much for your help, and regardless of the outcome, for your sincerity and your help here, I'm going to be glad to publish a magazine article about you, sir.
Well, okay, but Neil, that's okay. But I need everybody to get this.
Mm-hmm.
The more that people know about me, the more humble I must become.
Mm-hmm.
Okay, I do not want thanks. I work for you. I work for people. This is not a sales pitch. Understand something. My mission and my passion is to try to touch those and help those that want to be touched. And you can try to find a hole in that or trying to find out what I'm really up to, but I'm up to nothing but that. And understand this, Neil, you deserve to have your life back if you really want it. But Neil, you got to get this. After a person has had an injury, because this is an injury emotionally and physically to you, for more than 9 months, it's very difficult to get rid of it because your subconscious takes it on as normal. Do you understand? Okay?
Yes, I do.
Okay.
So let me finish the last part of my injury.
Take your time.
So now recently what happened is when I go out somewhere, and if I don't have my foot elevated, if I keep my foot on the ground too long, my whole foot starts to get swollen. I have a photograph if you wanted to see it at some other time, I'll send it. But as long as I keep my foot elevated, so if I sit down for like more than an hour or two with my feet on the ground, then my foot starts to get swollen. But if I keep it elevated.
Can I explain now? Is it okay if can I explain?
Yes, sir.
Your ankle, your knee, and your hip have become a beaver dam in the leg river. So your leg, your whole body has got rivers in it. It's called your circulation. Now, what if I'm right and you've built up all this scar tissue in your ankle, in your knee, in your hip? Well, that's a bloody dam. So the reality is, it's not so hard for the circulation to go downward, Neil, but to come back up and to fight this crystallization and scar tissue issue that you have wrapped around your ankle, your knee, and your hip. And guess what? Gravity is your enemy right now. And understand this. Oh, I would look at, if I could just go like this, I swear to God, if I could go like this, Neil, and I could get you here right now, your foot could be swollen right now. Instead of having it put it up in the air, I could work on your ankle for 20 minutes, maybe 10 to 20 maximum. And your ankle, I could have you sitting, okay, not standing because there's pressure on it, but I could have you sitting where you can't sit. You have to put your ankle up to get the swelling down. But I could have you sitting, fighting against gravity. And all I got to do is go in there and untie the knots, melt the crystallization, and move out the calcium. And guess what? That swelling will be down in 10 to 20 minutes. Well, I need everybody to understand something. Yes. You know what? People will come and attack me because I come out of the gate and I go, it's BS. These are dysfunctional belief systems. And people are going, they don't like to hear it. Your subconscious won't like to hear it. That you've been dealing with something 10, 20, 30, and 40 years. Now you got this guy coming on and he's being cocky, and he's actually saying that he'll give you a money back guarantee when you just booked and you're supposed to go to surgery next week. Who does he think he is? Well, he must be desperate for money. That's all this story sounds like, and I get it. Go ahead, Neil.
Yes, sir. So, would you like me to tell you?
Oh, can you say, hold that for 1 second. Everybody, I'm going to tell you something. You know what? I'm going to do this. I'm going to do as much as I can with still leaving enough time for my children and for my beautiful partner, Lori. But if you call my phone number at 469-861-9454, if you don't get me, you leave a message. I'll bring you on and do a live with you. And I will respect you. I will not dishonor you. And I will do everybody that I possibly can. But make sure when you come on that you're willing to share your story. Nobody knows where Neil lives. Nobody's seen Neil's face. But Neil, just know that you have blessed people today with your courage. Go ahead, my friend.
Well, bless you so much. Yeah. So should I explain what I do dietarily to how my regimen is?
Yes, you should. But I do want to say something, Neil.
All right.
When we're all done, Neil, 1 second. You can tell me what you do with your diet, but here's the part you're not going to like. Okay. Okay. The cement has dried. Okay.
Right.
The knots are there. You can get the most beautiful diet right now. You can go on my advanced water fast, and guess what? It will help you to stop the problem from getting worse. Maybe. And I think I could be wrong. The reality is if I don't physically go in and pull the beef jerky apart and put the calcium back into the bones properly, okay, and melt the crystallization, well, there's not going to be any real transformation. But the reality is your diet does matter, but understand something. What started off as a symptom has become a problem onto itself, to the point that if it wasn't for you and your belief systems, somebody else might have had 1 to 3 surgeries, even 5 surgeries already done. Because everybody, you need to get this. You do 1 surgery, you're going to need another one. You do 2 surgeries, you're going to need 2 more. Because surgery creates so much scar tissue, and scar tissue creates the dam block, which cuts down your circulation, which causes more scar tissue formation and even can lead to a mutation. Listen, you go and talk to anybody that goes in and has a little fibroid removed from the breast. Not anyone, but many women. Or go find out where somebody had a fibroid or a tumor removed, or a cyst, or they've had an ablation done in their pelvis, and you'll find out they've had trouble forever because of the scar tissue that was left. Okay, becomes a block, and of course your circulation's decreased, and wherever there's circulation, there's going to be inflammation that could lead to mutation. I just talked to a lady yesterday, and exactly where they cut out a pea-size fibroid, and when it's pea-size, I don't even know what they're doing. I mean, and go ahead and do whatever you want to do. I'm not telling you I should do it, but we could go in there and with Wolfe non-surgical, DMSO, pain away essential oil, and some cell-sonic treatment, it probably is gone in about an hour treatment with us. You probably wouldn't be able to find it in 1 hour treatment. It's scar tissue issue. So guess what happened? They went and cut that out, and within a year later, guess what? Right beside the scar, she has another fibroid growing. And remember something, just so everybody knows this, 15 years ago, they used to say fibroids were benign, and then, tumors were mutations. Well, guess what? Today, doctors only call everything tumors. So don't tell me they're not scaring the crap out of people. Go ahead, my friend.
Yes, sir. So you want me to cover my diet then right now? Or?
Yes, sir. Take your time.
Okay, yes. So
take your time.
I've been a vegan macrobiotic diet since 1980 something. So and I do, and I've been very strict over the last 20 years. I drink like about 4 ounces of wheatgrass juice a day. I drink carrot juice with beet like a couple times a week or more.
Okay, but 1 second, we got to go back. Okay. The diet, you can walk through your diet, and the diet that you're doing is like a lot of it. So the reality is, if you didn't have all these injuries already, you'd be doing great. But you know,
Right.
you've got too many knots and stuff in there. But understand something: macrobiotic diet means there could be a lot of cooked food. I have this saying, and it's just a saying: the more you cook, the worse you look. The more you fry, the sooner you die. The reality is that I make most of my diet a fresh and raw diet, meaning that I do a lot of juicing. I do a lot of blender drinks with berries and oat milk. I might throw in the raw organic egg sometime. I'll do a large salad every day. Okay. You know, I will do whole grains and things of that nature. But at one time, just remember, I was a macrobiotic vegetarian, and I've never been so ill. I was better when I was eating animal products for myself. So understand, the more you cook, the worse you look, you know, because there's a lot of macrobiotic people. And when you cook food, you know, you're losing all the enzymes out of it. You're losing the water soluble vitamins out of it. So understand this. I am not keen on that. I'm keen on today. I believe today, with all the blue light poisoning, the 5G, you cannot go near any processed food because they're poisoning it all. So, you know, and the reality is today we've got to do things like humic fulvic, like black diamond and black gold a little bit every day if we want to make sure the heavy metals are down and the parasites are down. Go ahead.
I believe that the wheatgrass helps detoxify your body of heavy metals and other.
Yeah, but I will call that one-shot therapy. I will tell you this. Let's go through your diet, just walk through it, and then I'll tell you the things I would tweak, and then you decide if you think you should or not. How's that, my friend?
For example, yesterday I had a salad that must have weighed over 1.5 pounds, maybe almost 2 pounds, 1.5 pounds at least. And what it is raw cabbage, raw radishes. Everything's organic raw red cabbage, organic radishes, baby greens, raw cashews. I had organic olive oil. I never cook with oil. I don't put oil in anything when I cook. Nothing. But I don't. The only things I cook are like Brussels sprouts. I steam Brussels sprouts.
Okay, you're doing really good. I want to know what your bad habits are. Okay, come on, let's talk about your bad habits. How much water do you drink a day?
I try to drink a 1/2 gallon of water, but I also drink about a 1/2 gallon of tea. And the tea that I make is made with turmeric roots, and it's made with ginger roots, and it has chaga mushroom with turmeric, ginger.
Okay, so
and I make that tea, and I drink a
right
lot
off the
of that
bat,
tea.
Neil, you've got a beautiful diet. It's not the perfect day diet like we do, but it's a wonderful one. And let me ask you a question.
Avocado. I'll put avocado on my salad.
Oh, that's
the whole avocado.
That's beautiful. So what are your bad habits? Do you have any? Honestly.
I'm trying to. I know I do. I'm just trying to think.
It's okay. I'm not trying to put you on the spot. If you don't want to answer, please don't. It's okay.
No, I won't answer. I just can't think of anything that I think is bad. I don't take any drugs, not even aspirin. I don't take any aspirin.
Okay.
I don't believe in taking aspirin, and I
Neil,
don't want to take antibiotics.
How much do you weigh? How much do you weigh?
Oh, I'm 5'11", and I weigh about 147 now.
Holy smokes. Okay, whoa. Neil, I got to tell you something right now. Okay, so you're losing way too much muscle, my friend. Okay, so right off the bat, I would tell you to get on a product that's called Amino Boost, and SON formula. You need amino boost at least 2 times a day. Just please go research it. SON formula is the only amino acid formula that is absorbed 99% by anybody, no matter what condition they're in. They use SON formula in the cancer hospitals in Europe. So when people have cancer, because when cancer, the cancer will eat up your muscle. And do you know what everybody says after the age of 40? I'm losing weight, not 40, but definitely after the age of 60, 70, I'm losing weight. They're not losing weight, they're losing muscle. And you're losing muscle. We got to get them. We can't lose any more muscle, because if we actually go in there and get rid of the scar tissue and restore the calcium back to the bones and the crystallization, what's going to hold you up? You're 140 and you said you are 5'11", and you need another 40 pounds on you. So right off the bat, do you do any exercise, any upper body exercise in that wheelchair?
What I do is I try to, I try to, it's hard for me right now to make my own food, but I was doing everything myself pretty well in the last few months anyway, but until now it's been a little hard. But what I do is I like, how I have like a pee bottle, because I pee in a bottle instead of, in a big, like a big container. And then I go to pour it out, and then I wash it out. And I put the bleach in there, and then I shake it, and so I get exercise like that. I kind of shake the things, and then I try to wash the dishes, and I do things, and I purposely try to exercise my arms and things like that.
Neil, yes. I'm gonna tell you something right now.
Mm-hmm.
You need to go. You need to get Wolfe non-surgical. You're not getting out of there. And the reality is you need amino acids. So you need to build your strength back up. So you better think about that. Okay. The avocado is great, but you might want to take a look at having like beans every day, because, to get some protein. Okay. And I'm not big on animal protein, especially if it's not organic and free range, because then it's full of antibiotics. That's not going to do you any good. And the reality is nobody should be eating dead animals if they're in a wheelchair, because you already you've got stagnation and putrefaction happening in your large intestine because you're not exercising. If I was in your situation, I'd be getting it's called a thumper. And it's a vibrator, and I'd be putting that on my abdomen sitting in my wheelchair. Also, when I'm laying in bed, what's going to move the poop out, dude? You need to vibrate that whole abdominal area to loosen it up, so you don't get so much infection that goes to inflammation, that goes to adhesions. Understand here. I don't know what kind of money you have. We can talk about this later, but Neil, you're not going anywhere but down. And this is a sad story. You have to take massive personal action right now, my friend. And I'm going to tell you something. People say to me, well, Dr. Wolfe, how much is it going to cost? It's going to cost less to come to us than anyone else. I'll make sure of it. But the reality is you've got to get rid of the scar tissue issue in your joints. I mean, it's called issues in your tissues and junk in your joints. And dude, you're going down. And I'm telling you, you're not going to get out of there unless you take massive action. I would tell you right now that, Neil, we need to start loosening up the joints and the muscles, and you need to start exercising, and you need to get amino acid therapy heavy duty. If without amino acid therapy and some form of exercise, just get yourself comfortable, because you're not going anywhere. And understand this, everyone. You can think I'm cruel. This is where people come on and go, Dr. Wolfe, you are just nasty. You know what? The reality is why shouldn't we tell Neil the truth? I'm going to tell Neil the truth, and I'm going to tell Neil that I'll do whatever I can for him. Neil, I'll tell you what.
Okay.
You get your butt to Stuart, Florida.
Okay.
I'm going to be in Stuart, Florida for 3 weeks. See if you can get yourself there.
Okay.
And I can't do this for everyone, but Neil was so nice to come on. Neil, I will do the non-surgical on you for free. And you can come into the whole life coach class, Neil, and we will take a look at you. I will talk about how I feel about the way you truly are emotionally. Whether anybody wants to believe this or not, yes, I did not give myself this name. I'm known as a medical intuitive. I can tell a person's personality and how they are self-abusing themselves and they can't even see it. I can tell where they're going and what they're doing. And Neil, if you can get yourself to Stuart, Florida, or Texas, I don't know which one, but I'll be about the same length of time in Stuart, Florida, and Texas, and then I leave the United States to go to Canada, and then I go to England and Australia and Croatia and a few other places. But the reality is we will work on you, and I will come on live. You'll come into the class. I'll work on your ankles and prove that you can move your ankles when I'm done. Are your ankles completely frozen, or do you have mobility in your ankles still?
Well, in my left leg is okay, I guess, as far as the ankle goes. But my right leg, I can move my toes, and it just feels a little stiff. And then I get spasms in my calf a lot of times.
Okay, well, believe it or not, the spasms in the calf are dehydration, and it's not because you don't take in enough liquid. It's because of these blocks. Okay, guys, I want you to take a look at a river, and there's one big beaver dam in this river. How much is going to get down the river? Now, try to look at nutrition, like your minerals, your nutrients, your oxygen is something that has to travel. But when it hits crystallization and scar tissue and calcification, how much is going to get by? And then when it gets down there, how does it get back up? Because you're fighting gravity with all these blocks, and that's why your feet are swelling. Are you with me?
Yeah.
Okay. If you go, did you go and watch How to Reverse the Irreversible in my library at docofdetox.com? Did you go watch that yet?
I tried to, but I couldn't. It wouldn't open up because I don't know if it's my Wi-Fi or something.
Well, one second. Were you on a phone or a computer? And then if your Wi-Fi is weak.
It was, I don't know. It was, I didn't get on my computer because I didn't want to sit at the computer, but I could try to do that.
Well, you know what? You can sit at the computer. You can go on Wi-Fi. You can go on your phone as long as you want. If you get Tesla glasses, call me if you want, and I'll see about getting a pair to you as inexpensive as possible. But when you wear Tesla fluorine glasses, okay, you can be on there 24/7. You're not going to damage your brain or your eyes. Does everybody understand that?
Just the sitting down make my foot swollen, so I didn't want to sit too long at any.
Okay, well then guess what? You can lie down, and you can buy an actual stand that will actually jack your computer up. So when you're laying down, it'll be easy to see. Okay?
Okay.
Okay, you know what? Let's get rid of every block that's stopping you from moving forward. If you go in and watch my master class at docofdetox.com in my library, and go in there and watch Reverse the Irreversible, and I'll prove it to you. I'll prove you that that 98% of all surgeries are BS, and that everybody is in pain and suffering, and the whole cane to the walker to the wheelchair, you've been set up and sucker punched. And then go and take a look at how to become number one at the art of number two. And then we've got something to talk about, Neil.
Okay.
All right.
So I usually never have any problems with my bowel movement.
Neil, it's not what comes out, it's what stays in. And there's no person in the world that, if they're not walking and getting exercise, does not have a bowel problem. You better get that.
I see. No, I can realize that for sure.
Okay, Neil, I just want you to understand that guess what? There are people that are not in a wheelchair, that don't have a cane or a walker, okay, and they've got hemorrhoids, they've got fistulas, they've got diverticulitis, they've got colitis, they've got muscle spasms, and they've got a tummy that looks like they're pregnant, like they're 12 months pregnant. And I don't know how you can be 12 months pregnant and be a man, but whatever. But the reality is these people would tell you they have no bowel problems either. And I will tell you, everybody has a bowel problem, because people do not eat 80% whole plant-based, high vibrational diet. They do not drink structured water and warm to hot water. and a gallon of it a day, or at least, you know, women should be doing 3 quarts, men should be doing 4 quarts. And if they were doing that, because structured hot water cleanses the body. Understand?
Oh, so I shouldn't drink any. I've been drinking just regular cold water, so I should just make it.
Okay, so let me ask you a question. If I wanted to clean your house, should I do it with cold water or hot water? Which one, my friend?
Okay, hot water.
And if I was going to use water, should I use water that has no surface tension and actually goes into the cells because it's also already structured so the body doesn't have to do it? Now, whether you believe this or not, I've been drinking right out of the tap here, and I travel around the world. I take water right from the tap, and I just run it through a structure unit that has no filter. And guess what? Here, all water that isn't structured is trash and should be thrown out. Oh, I don't know who this person is, Powerland, but she's so right. She Powerland, you are so right. And you know what? It's the first time anybody's commented like this, love. And understand something. Rain is structured, fast-moving rivers, waterfalls. Understand, if you have a Kangen unit, if you don't run it through a structure unit, it's not structured. Okay, if you have a Berkey filter, it's not structured. If you have an ozone unit, it's not structured. If you have a carbon filter, it's not structured. If you have a distiller, worst water in the world to drink. Reverse osmosis, worst water in the world to drink. It's not structured and you can't hydrate. It's too heavy. And understand, I could go over and grab my structure unit and show everybody. Give me a second. Enjoy the view. I'll be right back. So anyways, this is a structure unit, and a lot of people are going to go, well, now I know he's full of it. And the reality is this, it's so amazing that we do not even think twice that we can actually get on a phone. Hello, yes, is this China? Wow, I can't believe that I'm talking into this box and somebody actually picked it up in China within 30 seconds. I can run my water right from a tap. There's no filter in this. And this is a structure unit. We sell it on our website. We'll give you a 90-day money-back guarantee. How's that, everyone? 90-day money-back guarantee. If you don't like it, just send it back. And you should run all your liquids through this. You would find that you would hydrate for the first time in your life, okay? And I mean really hydrate well. So there's my sales pitch. Now, just know this. We can talk, okay? I will do whatever I can for you, my friend. Did you hear me? All right?
I'm lit.
Just know that I will do whatever I can, okay? If you can show up in Texas or Florida, okay? If you can stay there after I leave, my son, Dr. Sage Wolfe, so I'm coming to do the whole life coach course in the Braveheart Health and Healing Circle. I do the Braveheart Health and Healing Circle, I think. Yeah, we ship to Europe, everyone. Is it okay to run distilled water through it? Absolutely. You can run any water through a structure unit and it's going to structure it. Any water. You'll notice the difference. Listen, that's why a mosquito won't land on structured water, because it'll drown. It has no surface tension. And structured water creates a frequency in the water that when you drink it and it comes near the aquaporin channel, which is in every cell, it actually causes the actual droplet to string out. Because did you know what a droplet's made out of? 2,500 to 3,000 layers of water, very thin layers. And when the frequency from the aquaporin channel, when it actually connects to the actual structured droplet, it strings it out like a choo-choo train and goes right into the cell. And it delivers your nutrition and detoxifies 1,000% better. It's nature's way of filtering, absolutely. And that's She Powerland. Thank you. And she's right. She's absolutely right. I don't meet many people that understand this, because everybody thinks life's supposed to be difficult. So anyways, my son, Dr. Sage Wolfe, he teaches the Wolfe non-surgical. And we will give everybody a money-back guarantee for every course we do, that the first day will blow you away. So just know that, everyone. Go to braveheartnation.com if you want to check it out. But here's the deal. If you can stay there for a month. Find a place. We'll treat you for free. And I'll have some of my master trainers treating you. And I can't do that with the whole world, everyone. So just know that. But I'm going to do that for you. But listen, Neil, unless you, here's the deal. Neil, here's the deal. Everybody complains and explains about how they want a better life. But guess what? Neil, are you passionate about living? Do you have a reason to live? Do you have a purpose, Neil? Because if you don't have a, 1 second, let me finish. If you don't have a purpose and you're not passionate about your life, and you are so passionate about getting out of that wheelchair and that you are determined to do anything, then don't show up. Because I'm going to tell you something, and this is where I'm going to get slammed here in a second. Okay? Are you ready?
I'm ready.
Okay. Here's where I'm going to get slammed.
Okay.
We are emotionally crippled before we're ever physically crippled.
I believe that.
Okay, and you were emotionally crippled before you ended up in that wheelchair. And you weren't emotionally crippled because there's something wrong with you, Neil. There was actually a belief system in your subconscious that you weren't aware of that sucker punched you. There's nothing wrong with you. There's only something wrong with the belief system that put you there.
Right.
Okay, I just want everybody to understand that.
Can I tell you one of the symptoms I recently
Please, sir.
had?
Please.
I looked at my leg, right, on my calf.
Yes, sir.
And let's say Invisible Man was pushing on my leg. It looked like it was pushing in like a half an inch. You could see it just like I could feel.
Can you repeat that again? I didn't get it. I apologize. Can you repeat that again?
Yes. It pretend that the Invisible Man was pushing on my calf, and I could see that I could see like it just like a finger pushing it in with there's nothing there, and it just went in like a half an inch, and I could feel the spasm.
Can I tell you what that is? Can I tell you what it is? That's actually spasm of the scar tissue. So when the scar tissue gets its own little cramp going, it contracts. Okay. You know, this is what happens in a woman, you know, when her uterus will flip on itself because of inflammation. It curls up. And that can come back. Listen, all you women out there right now, if you look up vaginal infusion, I don't care what the problem is in your vagina, this is the most powerful thing you can do. And for a woman, it's more important to put your nutraceuticals in your vagina than in your mouth. It'll heal you 1,000% faster. Okay? So, but I'm just telling you that what happens is when things curl up, okay? And that's what happened with you, Neil. The knot was curling up, okay? And it went into spasm. So when it did that, it put a dent in your muscle, okay? All right. It's called turtling. It's called turtling, okay?
Okay.
All right.
So,
okay, somebody, can I say something, Neil? This person says, yeah, but rivers don't have fluoride or chemicals added. Now, I know you're not going to like this, and this is where you're going to write me off, and that's okay. I get written off a lot. As soon as I run the water through a Wolfe a Wolfe structure unit, okay, Doctor Detox structure unit, guess what? It takes the fluoride and it takes the chlorine and it makes it innate. Oh, wait a minute, but Dr. Wolfe, it's still in there. Yeah, but guess what? What you don't get is frequency overrides everything else. The invisible creates the physical. And we can actually change the physical to make it, okay, non-toxic, even though it still shows up. How many people here know that you can go and filter your water with a carbon filter, or you can do it even with a distiller, but you still leave the frequency of the drugs and the chemicals in there until you structure it? Okay, let me ask you a question. How is it that when the rain comes down, it's not filtered? Where's the filter there? So we've got what? We got the heavy metals in there. We got the plastics in there. We got the aluminum in there. We got the acid rain. Why isn't it burning the grass? Why isn't it killing the birds, the bees, the flowers, the trees, and all the microorganisms? And why is it that the crops grow just as good as 500 years ago, even though we supposedly have such toxic rainwater. Because guess what? That which you call God or creator created it in the ozone layer, that it would actually structure the water before it came down, because the universal creator knew that man was so manipulative. He was one step ahead. There. Now you can take that to the bank. It's called fourth phase water. It's called structured water. And it is the water that is the most important on this planet. Okay.
Darrell?
Yes, my friend.
I'm sorry to interrupt you, but yeah, I have a 6-filter water system, but it's one of the best. There's probably better, but it's real good.
Anyway, I don't care if you've got a 6-phase water filter. You've got to put structuring on the end of it. Do whatever you want. You can ozonate it. You can filter it. You can dance. Well, I'll tell you what, if you danced and prayed on it, that's probably structured. Because guess what? Everything is intention. Everything is frequency. You know what? I'm going to tell you something. When you have felt so happy and so full of joy, or just even if the creator has touched your heart, you're not in pain. Everything is frequency. Understand that.
Yes, someone told me that an ozone therapy would help my life.
Okay, ozone therapy will help when we get rid of the physical blocks. Ozone therapy is going to only temporarily help you. Do you know who brought ozone therapy into North America? Ed McCabe, and Ed McCabe did it the most. And I brought ozone therapy when I lived in Canada, but now I live in the United States and Mexico. But I brought it into Canada, and then guess what? I got reamed out for it. The government came after me, but it doesn't matter. Ozone therapy is great, but understand, I stopped doing that because guess what? I'm not into silver bullet therapy anymore. I'm after getting rid of the issues in your tissues and the issues in your mind, because everybody's mind is almost a landmine, because the beliefs they mainly use to run their life are beliefs that are from toxic systems and programs. I mean, there's a lot of good people out there, but there's a lot of people that are trying to rule, school, and fool us and pretend that they're actually empowering us. Yes or no, Neil?
Yes, like Anthony Fauci. Yes, I agree.
Well, yeah, but it's not just that. I mean, you can't go to school without getting schooled. So, okay. Anyways, we'll get off that topic because I don't want to be there too long. Neil, are we good? Is there anything you want to ask me before I jump? Because guess what, everyone? Right now, I'm just finishing off with for my team, and we're redoing what's called the Perfect Day Guide for all of our patients and clients that come to us. When you come and get a consultation from us, we give you a 400-page manual, PDF, okay? Or we will sell you it in a hard copy for cost, and it's called the Perfect Day Manual. And don't believe me, but you go ahead and read and get a consultation and read through the Perfect Day Manual, and guess what? You'll be smarter than the last 100 practitioners you went to see, because this is about training, not treating. And understand something, 99.9% of all natural health practitioners and all medical people treat you. They don't train you. Unless your practitioner is empowering you to learn what they're doing so that you can move forward in your life. Why are you doing it? Now, understand, there'll always be part of the population that just wants to be treated, never wants to be trained. But guess what? If you want the life that you were told that you could have, then you've got to be the master of your mind and your body. And that's why I'm telling you, Neil, I get it. Being crippled, and you're not crippled, but it kind of crippled you up. You're in a wheelchair. Okay.
Yeah.
You need to understand something. I will do what I can do, but you got to meet me with massive personal action that you want to get out of that wheelchair. You got to prove it to me. Okay. And you're going, what do you mean? I don't need to prove it to you, Darrell. Well, let me tell you. What?
Can I pay you a small fee just to give me a bullet points, a regimen on what I should do before I come to Texas?
No, I won't take any payment. But what I will do is tell you that I want you to take the money. I want you to take the money and at least maybe get some of the nutraceuticals that I asked you to get. Okay, if you can.
Absolutely, I absolutely will. Just can you text me the link because it seems
somebody
like
said yes,
and
and Dr. Wolf's going to take $10,000 from you. Yeah, really? Okay, I'll tell you what. What I'm going to do is I'm going to empower him. Does it take $10,000 for some people to get better? Yeah, because they're in such trouble. I mean, it costs $9,000 to take my course, which is the whole life coach certification and the Wolfe non-surgical. So, but guess what? That's not for you. I'm just saying this, Neil. That's not us talking. I'm just telling you that I guarantee you that you'll have the emotional training, you'll have the nutritional training that other practitioners won't have. And with the Wolfe non-surgical, I'm giving you a money back guarantee that it's the most powerful body work, more powerful than anything out there. And then here's another thing. With the pelvic restoration course, if you're taking another course, it's only $1,800 for that 3-day course for women. And then if you want to come into my Braveheart Circle, that's $3,000 for a 7-day course where we go. Stop scamming, folks. That's what the Tookie Dome says. All right. So anyways, everybody's got their opinion. So if you want to come to the Braveheart course, it'll be 6 days. And then 1 day, it'll be 6 days. So 3 days on, 1 day off, 3 days on. And everybody has the choice to come for 1 day. And then if they don't like it, then we'll just refund your money. Okay. All right. So this guy, Globe Trekker, he comes on all the time here and he just wants to badmouth me. And, we're always going to have that. So understand, in life, ignore those people. And you know what? Even if you have something that you're passionate about, if you love, talk to those people that you know are going to love what you do and they're going to get behind you. Don't expect the world to buy into your dream. You need to buy into your dream and you need to hold the line. For most of us adults, what we need to do is go back and go, let's take a look. Let's take a look at what I wanted when I was younger, when I was excited, when I had so much energy and I just wanted to move forward. Okay? Take a look at the dreams that you left behind and see if you can dust them off and bring them back up, because every one of you, those dreams and that passion that you have, that is actually the gift that you need to give the world. Everybody here came for a reason and came for a purpose. Go back and claim that. Okay? Go back and claim it. All right. I want to thank everybody for joining me. Neil, you can give me a call when we're done here. Okay? All right?
Okay. So what should I call you in about 20 minutes?
Call me in about, actually, if you could call me in about 3 hours. I got to get back on with my team to finish off this perfect day manual. Okay. And I want to thank everybody for joining us today. I'll be back on here tomorrow. And I will be taking Tookie Dome, and you will be blocked. You won't be coming back onto the platform because all they're saying is scammer. He's going to steal your money. We need a monitor on this channel. Yeah, well, stop stealing from people. See, it's the same person saying it over and over again. Yeah, people that judge are people that judge themselves. And understand something. We don't need a distraction in our life. It's like this. People say, family's everything. Well, family is everything, okay, long as they hold the vibration for your passion, your purpose, and your dreams, okay? There are people in my family that they have different belief systems. Just you know what? Find your happy, connect to your breath, and know it's okay to love and care and honor yourself. That's all. Don't ever think that you ever have to spend a penny from me, but I will tell you one thing. Why don't you go into my library and you'll see that I have given you something that is not out there. It is the biggest self-help, self-love library in the world. Go to docofdetox.com and go in there and dive into Reverse the Irreversible, how to become number one at the art of number two. For you women, go watch I Am Woman. And for those of you that want to hear the history about why we are where we actually believe that taking petroleum products is going to heal us, and that chemo, which is mustard gas, is going to cure us, why don't you go and watch Medical Mafia? Go watch that and you'll see the whole history of what happened and what took only them 100 years to program us and numb us out and not honor, love, and respect ourselves. Okay, but go in there. I've got so many guides. I've got a 5G blue light poisoning. It'll explain everything to you. I've got the emotional chemistry of cancer, disease, and healing, which is the biggest cancer study that was ever done, that shows that it all starts off emotional. Okay, all right. Listen, just know this. Put a happy smile on your face, connect to your breath, and know that that which created the universe has always loved you. Thank you, Neil, for coming on, and thanks everybody else. Have a beautiful day.
I'll talk 4:45. Thank you, sir.
We will talk again, my friend, I promise.
Darrell.
Here's the part yes, my friend. Okay. Bye, everyone.
Thank you.
You're welcome, my friend. Take care, everybody. We'll see you tomorrow.